In a world where over 2 million children die every year from pneumonia, tomorrow marks an important day for us, November 2nd, World Pneumonia Day. I'm here today with two key influencers in this field, and they'll be helping us find out more about the disease and what we can do to eradicate it in future. Please welcome Professor Samir Saha, Professor and Head of the Department of Microbiology, Bangladesh Institute of Child Health at Dhaka CHRF Hospital and Executive Director of Child Health Research Foundation, as well as Dr. Desmond Turner, Honourable Member of Parliament from the United Kingdom, Chair of the UK All-Party Parliamentary Group on Pneumococcal Disease Prevention in the Developing World. First question for Dr. Saha. Why are you only talking about pneumonia now?
We were knowing pneumonia for long who are working in the field of health. So we are working in the hospitals, we know about pneumonia, but possibly the policymakers or the people, or we are not in fact taking care of pneumonia in that way as we should be in all these years. So we are calling it as a forgotten disease or it's a neglected disease, because this disease is mostly prevalent in the developing countries, and again the poor people, children of the developing countries. But this time, a lot of universities, a lot of countries, all of them are getting together and to make sure that this is the largest killer of the children. So we want to put our head together so that the policymakers are coming forward to do the needful to prevent this disease and the deaths from this disease.
How would you describe the current issue of pneumonia today?
Overall in the world, in fact, pneumonia is the largest killer, but 98% of those deaths are in the developing countries. And of these developing countries, our country and these regions, the largest number of children are dying from pneumonia. And most of these deaths are in the community, in fact. Only a small part are coming to a facility to get the treatment. So most of them are dying in the community, so people are not knowing about this. And also, if we want to understand the magnitude of this disease, 1/3 of the beds of the hospital at any given time are occupied by the pneumonia patients, where in fact there is a fierce competition to get the bed after some time of the day. So in fact those patients are shuttling from one hospital to other because of bed crisis, while most of the beds are occupied by pneumonia patients. That's a huge burden.
What is the pneumococcal disease burden?
Oh, pneumococcus is one of the predominant cause which is causing pneumonia. So pneumococcal disease is, if we talk about pneumococcal disease, it's not only pneumonia in fact. It causes other diseases as well. So pneumonia, then septicemia, which we mean the infection in the blood, and also meningitis, which means infection in the brain. So it causes in fact spectrum of diseases, and all of them, pneumonia is possibly the milder version of the disease that pneumococcus can cause, and which is causing this number of deaths. But in addition to that, it is causing infection in the blood and causing meningitis, that infection in the brain. And if I talk about the magnitude of this disease, there are large number of, about 50% of all etiologically known cases of meningitis are caused by this organism.
Right.
And the mortality rate from this meningitis, pneumococcal meningitis, is very high. It's about 25% of the children are dying who are having this disease. And again, 50% of the children who are surviving from this infection, they are having disability. So that's a very big problem, and these disabled children are not only remaining as disabled, they are becoming handicapped and becoming a very big problem for the family and society.
What do you think Bangladesh should do to prevent pneumonia?
I think we should take a comprehensive measure to tackle pneumonia, because it's like the treatment is inexpensive, so we can treat them, but unfortunately only a small part of the mothers can or caregiver can recognize pneumonia, and only 1/3 of the babies are getting the treatment in fact before they are dying. So that's there, but treatment is inexpensive. So it's very unacceptable that children are dying when inexpensive treatment is available. We also can think about if we can promote breastfeeding, a good number of children can be saved in getting pneumonia. But in addition to that, in recent years, the most, you can say, low-hanging fruit. So that's also available, the immunization by the appropriate vaccine. And if you consider Bangladesh, I think that should be a very big priority, because our immunization program is appreciated by the whole world. We have very few things to be proud of, but immunization program is one of few which is going very well, in fact. And its coverage is very high. We have already eradicated several diseases.
Is there anything else now that can help with prevention of pneumonia without the vaccine?
Possibly hand washing, breastfeeding, and good nutrition that also can help in preventing pneumonia, at least the pneumonia deaths.
And what do you think countries should do now?
Country should consider improving the community clinics, which this government was thinking in fact long before. They should go ahead and do that so that the caregivers can take their child to those clinics and get the care at real time. Because most of the time when the babies are coming to the places like Dhaka Shishu Hospital, that's very late. The children who are dying from pneumonia in our hospital, they're dying within first several hours in fact. The doctors have very little to do. But contrast to that, if we can really do something in respect of community clinic, then the caregiver can bring the child in at real time and they can be saved. So that is one way they can do. But as the prevention will be more cost effective, and definitely that will be helping us in many ways in saving the resources as well. So government should take the opportunity of the resources which are already available for this vaccine, specifically for this vaccine. It's very expensive, but we can get it with very minimum price if we can apply to Gavi and get our application approved.
Okay.
That's government can do immediately, in fact. I mean, we are delaying by a month, we are losing many children. So because children are dying every day.
Speaking of government, Dr. Turner, you've come from the UK. Why is the British government interested in getting involved in this issue?
British government is very serious about international development work, and we're serious about the Millennium Development Goals. And one of those Millennium Development Goals is a massive reduction in child deaths by 2015. And the best way of achieving that and saving all of the health impacts that Dr. Saha has been describing is to promote the vaccination against pneumococcus, because pneumococcal disease is the biggest killer. It's the one that stands out. It kills more children than AIDS, malaria, etc. put together. So it's a big killer. And not only is it a big killer, but it's technically possible to prevent most of it. And where you can prevent, that's the most effective thing. And that is one of the most effective ways in which Western governments can use their resources to help the developing world. And that is what the UK government has done. It has collaborated with other governments and with the Gates Foundation in order to set up a program at a cost of $1.5 billion to create vaccines which are suitable for Africa and for Asia, where the nature of the bug is different to what it is in Europe and North America, where we have vaccines, but they're not suitable. They will not be as effective in the developing world, and they're much too expensive. So in order to get a vaccine that's effective for the people that need it, and at a price which developing countries can afford, and we're talking about not $60 but 15 cents, then that is what the advanced market commitment is going to do. And the vaccines have been developed. They've just gone through clinical trials. It's nearly ready to go. And if Bangladesh succeeds in being one of the first countries to receive the vaccine in next year, then it will have an immediate impact on the deaths of children in Bangladesh, and will save thousands of young lives. Not only thousands of young lives actually saved, but all those who otherwise might have grown up with disabilities with all that that implies.
You mentioned if Bangladesh is able to get the vaccine. Are there other countries right now that are competing for the vaccine?
Well, there's a whole host, for a start, there's a whole host of sub-Saharan African countries who will want it and who need it. So it may be difficult to do everybody at once, at one go. So someone's have to get in there first. But Bangladesh has a high disease burden and should be able to make a very strong case for being one of the early ones.
Is it a question of funds?
I don't think so. I think more a question of how quickly they can produce massive quantities of the vaccine.
Right. So why do you think overall that this issue is so important to developing countries?
Well, it's because developing countries are suffering from it. And it's a great cost to those developing countries, both in straight human terms and the cost to their economies of looking after children who are damaged by meningitis, for instance, and so on. It's a developing country problem. So the developing countries should have the help.
So I know that you're only in Bangladesh for a few days. What will you say when you go back to the UK about your experience here and what you've seen?
Well, I haven't actually seen very much except the fantastic traffic on the way from the airport to the hotel. But what should I say? I love visiting the Indian subcontinent. It's very colourful, people are wonderful, and I'm very impressed by the determination and professionalism of all the Bangladeshi and Pakistani clinicians that I've met.
Do either of you have any further comments you'd like to make about the disease and any information that you feel that needs to be shared?
I think one thing which needs to be shared is a message of hope. This is the first World Pneumonia Day. We've had, for many years, World AIDS Day, because everyone throughout the world is aware of the impact of AIDS, and conscious of it, and trying to do something about it. But World Pneumonia Day is new, and it presages the fact that when everybody meets next year for World Pneumonia Day, almost certainly, because of the global vaccination program, there will have been thousands upon thousands fewer child deaths, and that will be something to really celebrate.
Thank you both to my guests, Dr. Turner, Dr. Saha, and remember to mark your calendar tomorrow, November 2nd, 2009, World Pneumonia Day. To summarize, we've learned a lot about pneumonia today as a disease and what we can do to help eradicate the problem, hopefully looking towards a cure now that we have World Pneumonia Day in 2009. Thanks for watching and hope to see you again.